Understanding diabetes, blood glucose, blood pressure, temperature, and pH according to the yin-yang theory, Part 68. Purpose. Search the accuracy of current treatments from both Western and Eastern medicines aiming to prevent diseases and avoid the cases of misdiagnosed treatments sometimes encountered in Western medicine. A. Notion of yin-yang in Oriental medicine. A good doctor must base himself on the four fundamental principles of diagnosis and the yin-yang nature of the disease to conduct a treatment. According to the specific protocol of Oriental medicine, if the doctor treats according to the person and number 39's statements, it would be a symptomatic treatment, possibly aggravating the disease. In energetic transformations, yin and yang must coexist harmoniously. If one aspect is lacking, the other would be predominant and will cause the disease. There is a saying in Oriental medicine, if the disease is in yin, treat with yang, weakened yin, yang becomes dominant and will cause the disease. If the disease is yang, treat with yin, weakened yang, yin becomes dominant and will cause the disease. That is why the doctor must know the yin or yang nature of the disease. Yin-yang classification. Yang viscera energy, X's functions back of hand, yin organs, blood deficiency structures, palm and yin. There is yang. The function of the organs represents yang and yin. It ensures the energetic transformations of all five elements. B. Explanation of yin-yang by the tensiometer, glucometer, thermometer, pH paper. The proper functioning of the billions of cells in the body helps to maintain overall good health. The four ingredients necessary for cells are glucose, protein, lipid, and oxygen. Our state of health is reflected in our body weight and blood pressure monitor readings. Qigong therapy, complementary medicine, has established the correlation table between blood pressure and age. Groups. Hand, the yin and the yang are in balance. If the temperature is hot, higher than normal, on the back and palm of the hand, it is because the yin and yang are in excess. If the temperature is low, lower than normal, on the back and palm of the hand, it means that the yin and yang are insufficient. If the temperature at the palm of the hand is warm, higher than normal, while the temperature at the back of the hand remains normal but lower than the temperature at the palm, the yin vacuum is causing internal heat. The body temperature is warm, but the person likes to cover up and drink hot drinks. If the temperature on the back of the hand is low below normal, and lower than the temperature on the palm, it is the yang vacuum that causes the internal cold. If the yang in the yin is deficient, it is the decrease in the function of containing liquids, water, blood, sweat. The body will lose water through perspiration, causing fatigue and weakness. The saying of Oriental medicine says, yang deficiency causes spontaneous sweating. The following criteria can be used to determine the yin or yang nature of the disease. Yin nature, illness inside the body, insufficiency, cold, chronicity, fear of cold, weakness, fatigue. Craving for hot drinks. Nature yang, disease on the surface, excess, heat, acute, body heat, desire for coolness and cold drinks. B. Explanation of yin-yang by the tensiometer, glucometer, thermometer, pH paper. The proper functioning of the billions of cells in the body helps to maintain overall good health. The four ingredients necessary for cells are glucose, protein, lipid, and oxygen. Our state of health is reflected in our body weight and blood pressure monitor readings. Qigong therapy, complementary medicine, has established the correlation table between blood pressure and age. Groups. 5 to 12 age years, systolic 95 to 100, diastolic 60 to 120, mmHg, 60 to 120 BPM equals beats per minute 13 to 17 h-years systolic 100 to 110, diastolic 60 to 65 mmHg, 60 to minus 65 BPM 18 to 40 h-years. Systolic 110 to 120, diastolic 65 to 70 mmHg. 65 minus 70 BPM 41 to 59 h-years systolic 120 to 130, diastolic 70 to 80 mmHg. 70 to 75 BPM 60 h-years and plus systolic 130 to 140, diastolic 80 to 90 mmHg. 70-80 BPM blood glucose levels according to WHO, World Health Organization, in 1979 are: before meals, 100 to 140 milligrams per deciliter. After meal, 140 to 200 milligrams per deciliter. The tensions of a person aged 18 to 40 years are used as a reference to explain the diseases according to yin-yang. Systolic, 110 to 120 millimeters of mercury. Diastolic, 65 to 70 millimeters of mercury. Pulse, 65 to 70 BPM 1. The systolic represents the energy, yang. In Oriental medicine, the maximum value is 120 millimeters of mercury. Oriental medicine calls extreme yang. If more than 120 millimeters of mercury, it is excess yang. The minimum value is 110 millimeters of mercury. Oriental medicine calls small yang. If less than 120 millimeters of mercury, it is deficiency of yang. 2. The diastolic represents blood, yin in Oriental medicine. The maximum value is 70 millimeters of mercury. It is extreme yin. If more than 70 millimeters of mercury, it becomes excess yin. The minimum value is 65 millimeters of mercury. It is small yin. If less than 65 millimeters of mercury, it does mean insufficient yin. 3. Example of excess yang. Excess yin. The tensions of a person aged 60 and over serve as a reference in this case study. Systolic, 130 to 140 millimeters of mercury. Diastolic, 80 to 90 millimeters of mercury. Pulse, 70 to 80 BPM for the person 60 years of age and older. If the maximum yang energy, systolic, value is 140 millimeters of mercury, and the maximum yin blood, diastolic, value is 90 millimeters of mercury, then that person does not have high blood pressure, as there is no yang or yin excess. According to Western medicine, hypertension occurs when the systolic exceeds 140 millimeters of mercury. Yang excess gives a superficial pulse, i.e. a pulse that is noticeable on the surface of the artery, and yin excess gives a wide pulse because the artery is well filled with excess blood. If a young person has the same blood pressure as an elderly person, then that young person has hypertension, because there is excess yang and excess yin relative to his age. Hypertension occurs when there is yang-yin excess, even if the systolic is less than 140 millimeters of mercury. This is why children who have the tensions of a teenager have hypertension and often bleed from the nose by rupturing the nasal capillaries. 4. Insufficient yang case and insufficient yin case. The tensions of a child and an adult serve as a reference for this case study. Child, 5 to 12 years. 95 to 100 millimeters of mercury, 60 to 65 millimeters of mercury, 60 to 120 BPM. Adult, 41 to 59 years, 120 to 130 millimeters of mercury, 70 to 80 millimeters of mercury, 70 to 75 BPM. If an adult person has small yang, systolic, less than 120 millimeters of mercury, or equal to a children's systolic, then that person is suffering from yang deficiency. There would not be enough energy to ensure good blood circulation, causing the body to feel cold, difficult to breathe, easy sweating. Low and weak heartbeat. Taking a pulse, in Oriental medicine, gives a deep pulse, detectable in the depth of the artery. If an adult has the small yin, diastolic, less than 70 millimeters of mercury, or equal to a children diastolic, then that person suffers from insufficient yin. There would not be enough blood in the bloodstream, causing warmth to the heart, chest. But the temperature remains low, anxiety. Taking the pulse gives an empty pulse. Oriental medicine can detect various illnesses, not detectable in Western medicine, in the following combinations. Excess yang, superficial pulse, insufficient yang, deep pulse, excess yin, ample pulse, insufficient yin, empty pulse, excess yang and yin. Insufficient yang and yin, excess yang and insufficient yin, excess yin and insufficient yang in the treatment of hypertension and diabetes. When there is no more yang excess and yin excess, hypertension. When there is no more hyperglycemia, diabetes. Always continuing the medication will make an excess more and more insufficient and thus lower the arterial tensions that could cause cancer. Knowing that hypotension and hypoglycemia will give birth to other diseases, and by continuing the medication, it is lending a hand to the monetary gains of the pharmaceutical industry controlled by powerful industrial tycoons, like money talk. Blood pressure values according to the stages of cancer progression: stage 1 to 95, 65 millimeters of mercury, not yet detectable in Western medicine; stage 2 to 90, 60 millimeters of mercury, not yet detectable in Western medicine; step 3. 80-85 55 60 millimeters of mercury, cancer installed; step 4 to 75-80 50 55 millimeters of mercury, cancer installed; final stage 70 to 75 50 to 54 millimeters of mercury. At this stage, the blood F2O3 formula has no oxygen, but contains only iron. As in cases of blood cancer, the diastolic of 45 to 50 millimeters of mercury means the loss of blood, leading to muscle wasting, weight loss. No matter the treatment methods in Eastern or Western medicine, as long as they increase weight, blood pressure, blood sugar, are appropriate treatments. If the cancer worsens from stage 1 to stage 2, treatment should be stopped. Western medicine tends to complete all the planned steps, chemo-radiotherapy, even if there is an aggravation leading to death, and sorry, we did our best. 5. The heartbeat represents the cold and warm states in Oriental medicine. The number of beats per minute varies by age group. Children 5 to 12 years, 60 to 120 bpm; teenagers 13 to 17 years, 65 bpm; young adults 18 to 40 years, 65 to 70 bpm; adults 41 to 59 years, 70 to 75 bpm; aged 60 and over, 70 to 80 bpm. Few people know that the pulse in children is different from that of adults. At rest, 60 bpm, and during activities, 120 bpm. This temporary high pulse does not mean an infection. This is why adults who babysit and play with children get tired quickly, but not children. The average pulse rate is 70 to 80 beats per minute, minimum 70, maximum 80. A pulse below 70 bpm makes the body cold, a temperature below 36 C°, and a slow, retarded pulse. A pulse above 80 bpm gives warmth to the body. A temperature above 36.5 C° and an accelerated, rapid pulse. 6. Internal cold, external cold. Internal heat is measured by the salivary pH. The more the pH tends towards acidity, i.e., pH 6 and below, the colder and more acidic the blood becomes. An acidic environment favors the development of cancerous cells. External heat is measured by the non-contact thermometer. A temperature of 36°C and less indicates a slight cold, less than 35°C the thermometer displays low. A temperature of 37°C and above indicates a state of heat. Over 40°C indicates fever. 7. Cold disguised as heat. Heat disguised as cold or chronic diseases that are difficult to treat. The low pulse of 65 bpm indicates cold. But the temperature measured at the skin is above 37°C. According to Oriental medicine, it is cold disguised as heat. The high pulsation of 90 to 120 bpm indicates a state of heat. But the temperature measured on the skin is 35°C or lower or low. It is heat disguised as cold according to Eastern medicine. 8. Blood glucose levels. Do temperature degree cold or heat always cause illness in Oriental medicine? Excessive thirst and glycosuria are acute cases. There is no such thing as chronic diabetes. Acute cases are the three excesses: excessive thirst, excessive urination, and excessive hunger. The person eats a lot but always remains thin, due to the lack of food processing and absorption. Incorrect treatment would lead to malnutrition, physical deterioration, heart failure, and death. Without knowing the nature of the diseases, yin-yang, excess insufficiency, cold heat. The treatment can make an excess more and more in excess, and an insufficiency more and more in insufficiency, leading to death. An appropriate treatment brings back the tensions and the temperature to normal values. When there are no more states, heat, cold, insufficiency, excess, the treatment is stopped. On the other hand, Western medicine continues the use of anti-diabetic drugs, making insufficiency more and more insufficiency. Differentiation of diabetic cases. A. Non-diabetic case. Tensions are the tensions corresponding to the age groups. Pulse, 70 to 80 bpm. Temperature, 36 to 36.5°C. pH 7. Blood glucose, before meals, 100 to 140 mg per deciliter. After meal, 140 to 180 mg per deciliter. The two following cases are non-diabetic. Tensions are those corresponding to the age groups. Pulse, 70 to 80 bpm. Temperature, 36 to 36.5°C. pH 7. Blood sugar levels after a meal, either 120 mg per deciliter or 300 mg per deciliter. These blood sugar levels do not indicate either a lack or excess of sugar, but mean that the body organizes the transformations according to the needs of the moment, to always maintain the balance yin-yang, cold, heat, excess, inadequacy. The disturbances of the yin-yang, cold, heat, excess, and deficit balance are described below. B. Hypoglycemia, not identified as diabetic. For fear of being diabetic, the person avoids sugar. Therefore the blood sugar is low, 120 mg per deciliter. The pulse would be low. Consequently, the temperature is low and the pH is acidic. pH 5, i.e. the blood is acidic and the blood sugar content is insufficient. This condition gives indigestion, esophageal reflux, increased liver enzymes. C. Case A, not diabetic, but identified as diabetic. In Western medicine, long-term use of anti-diabetic drugs will cause low blood glucose levels of less than 120 mg per deciliter. High pulse rate 110 bpm, low temperature, low pH, acidic pH. Apart from glucose, which is a yang functional sugar, sugars from other sources, food, rice, vegetables, will lead to acetonemia and liver cancer. The cause is the drop in blood sugar value, indicating diabetes, which makes an entire population diabetic. D. Hyperglycemia, a blood glucose level of 300 mg per deciliter and a pulse rate of 90 bpm indicate internal heat. A temperature of 37.5 C indicates external heat. A pH 8 means that yang generates internal heat, which will generate the acute states, excessive thirst and excessive urination. It is enough to stop consuming glucose for a certain period of time. To decrease heat, pulsation, drinking sugarcane juice to hydrate and compensate for the thirst. The glycemia will go down without any medication. For fear of diabetes, one avoids sugar. The body has no more sugar, why take in addition medicines to lower the sugar? E. Blood sugar levels resulting from yin sugars are the cause of cellular degeneration and leg amputation. The amputation is a consequence of diabetes treatment with continuous insulin injections. But the blood sugar level is still high at 300 milligrams per deciliter and the pulse is low at 60 bpm. The low pulsation indicates internal cold, therefore the blood becomes denser, hindering blood flow. The temperature is low and the pH is acidic. A cold, acidic blood, without oxygen or sugar is no longer nourishing. It is the cause of cell death, insensibility of the feet and amputation. We should ask ourselves why blood sugar levels are high by 300 milligrams per deciliter and more. When we do not consume glucose, and at the same time, we receive insulin injections. The explanations of Western medicine are much more misleading. Sugars come from food, fruits, vegetables, causing the decrease and restriction of the diet, which further weakens the sugar intake and health. Before the appearance of the glucometer, there is no disease called diabetes. Eating habits were normal and diversified. The glucometer encourages the notion of sugar content, hyperglycemia, hence the appearance of strict or varied diets. And the appearance of high blood sugar levels of 300 milligrams per deciliter and more. The glucometer gives the global value of non-functional yin sugars, sucroses, and functional yang sugar, glucose. We are therefore all fooled by the interpretation of the glucometer values, leading to unnecessary medication. Glucose has the chemical formula C6H12O6. The molar mass of glucose is obtained by adding together the atomic molar masses of the constituent elements. Atomic molar mass of carbon, C12. Atomic molecular weight of hydrogen, H1. Atomic molar mass of oxygen, O16. Molar mass of glucose, 180 grams mole, 6 by 12 plus 12 by 1 plus 6 by 16 equals 180 grams mole.